Hello everybody, my name is Sarah Morey. I own Sarah Annette LLC, and today I just wanted to talk a little bit about advocating for yourself. So I usually talk about advocating a lot in childbirth because I have so many new pregnant moms coming to me or they've just had a baby, and the biggest startling thing that they realize is that they assume somewhere along the way somebody was going to explain what was going to happen or give them choices or tell them, how to breathe in childbirth, or hey, you can pick this or this, and all of a sudden they're in labor and they realize nobody's ever explained that. They've been going to all these appointments, no one said anything, and it just happens to them. And so the next time they give birth or are pregnant, they want to know more information. And so for me, one of the biggest things I can help pregnant women and anybody in any medical situation do is advocate for themselves and make truly informed decisions. So while I might have a bias toward natural or non-medicated anything, the bigger takeaway is that the more questions you can ask and the more informed you are, the better your choices are going to be for yourself and you and your baby, especially in childbirth. So one of the first things is learning to ask questions. And so many of us, myself included, have what's called white coat syndrome. Is all of a sudden a doctor, we've grown up like they're kind of people in authority, and we need to listen to them because of course we're coming to them and they just know everything. And doctors do know a lot of things, but they all have their own opinions and their own background and training. And a good medical personnelist or doctor or anyone in that kind of position should actually welcome any questions you have. And of course there's a right way to ask questions. Like we don't need to be adversarial or like, I know you're not telling me the truth, but just asking questions. And that can also be a good clue that you have a good provider, is if they're willing to answer questions. Like I recently went to a doctor and I was explaining that, hey, I looked this up and I really want to learn, and what do you think about this? And he was like, I love that you are thinking about this. And that's a good provider. Like they encourage questions, because if they're really good, it's an opportunity for them to explain why they want you to do what they want you to do. Or it might open up a whole new thing for them and get more information on their end too. If you have a provider who's resistant to questioning, that's a clue for you that you might want to find another provider. And that's another key, is that you get to pick providers. Even in childbirth, I have women switch care very late in pregnancy, or any, whether it's cancer, pregnancy, heart issues, you get to choose. You don't ever have to go with somebody. You can ask for second opinions. You can ask for second opinions even within the same practice. And they should always welcome that. Like, yeah, absolutely, go see what they have to say. And a really good one would be like, I'm curious to know what they say, and be open to hearing a different viewpoint. So those are big red flags if you're encountering a provider who doesn't want you to ask questions or doesn't want you to seek a second opinion. And so the next step is then asking the right questions. And again, going back to the white coat syndrome, like it seems like they're a person in authority, but they're just a person. You're going to seek their advice, and you get to decide if their advice is warranted or not. And that's the beauty of it, is because through asking questions, you should be able to figure out, like, this is a person I feel like I can trust because their answers seem legit, they're intuitive, like it seems like they know what they're talking about. And oftentimes you can come away being like, yeah, okay, thank you for explaining that. It sounds like I should do that. The big thing about informed consent, in order to have truly informed consent, you need to know all the pieces to the puzzle. And this isn't to say that providers are trying not to give you those pieces, but oftentimes we only are getting a certain angle of the picture. And if we don't know how to ask the right questions, we might not get all the information. And truly, we can't make a decision if we only know one side of something. You might end up wanting to do that anyway, because after getting all the information, you're like, yeah, that makes a lot of sense to me. I think I trust you, and that seems like a good thing to do. However, if someone comes to you and is like, okay, here's what we're gonna do. Ready? Or sign this, and you have to just sign it. Like, that's not informed consent if they're just explaining what they're going to do to you. So I recommend asking lots of questions. And an easy way to remember this is brain. So if someone comes to you, whether, again, it's for a treatment or pregnancy or labor or, let's just use an example in labor because that's where it comes up most for me, is a doctor comes in and says, hey, you're 39 weeks. It's time to talk about getting induced. Okay? And we could take that and be like, okay, I guess that's what my doctor says. He knows better than me. I don't know what. They must just know. And if we don't ask those questions, we just go down that road, and we might find out later there wasn't actually a great reason behind that, or there could have been a really great reason behind it. So say they come, hey, 39 weeks, let's get you induced. We'll put you on the schedule. Sound good? So the first question you want to ask is the B in brain. What are the benefits of me getting induced? And hopefully then your provider is going to explain, like, well, at 39 weeks, I like to induce everybody, and you'll be done being pregnant, so that's a benefit, and we'll just get that baby out, make sure, nothing happens, and it's just a good safety plan. So does that sound good? Okay, well, that's a good first piece of the puzzle. The second is the R in brain, is what are the risks involved? Are there any risks to getting induced? And this is where your provider really needs to and can be honest with you. This is where you're going to hear a lot of information. Well, the risks might be that the baby's like maybe a little premature because you might be actually only 37 weeks instead of 39. Sometimes it takes a while if your body's not ready to get induced, and you might be in labor for a really long time. If they're really honest, they'll give actual statistics like induction has a higher risk of C-section. Now this is where it gets a little bit dicey, because sometimes medical providers consider true risks like death or some injury happening, and those are risks. And those are true risks. And so they might be like, it's really not risky because chances are you're not going to die from being induced. However, there might be a whole slew of things that end up happening. So the next question is what are things that might end up happening or alternatives if I choose to do this treatment? So that's when you're going to get into things like, well, yeah, I don't consider, like, to them, they might not consider C-section a risk because it's a fairly safe surgery with risks of its own. But to you as a new mom, it might be something you want to be avoiding because you don't want major abdominal surgery, and that might be, okay, if I go down this path, I might end up have a higher risk of a C-section, and that's a risk I might not be willing to take. Okay, and then if I'm induced, I need to get an IV. I'm going to be on certain medications. Typically an epidural might be an actual type of risk in your mind of, well, if I can't handle the contractions because they're not as natural as going into labor naturally, then I'm going to end up needing more things. And so these are all pieces of the puzzle that you want to gather. Now, again, at the end of the day, you might be willing to take that chance because the benefits are outweighing the risks. Now, let me back up a second. Well, let's just keep going with the I. What could I do instead? So what are other things we can try? This is when the provider might be like, I'm fine with waiting till you're 40, 41 weeks and see what happens. But I just know all women want to be done being pregnant, so I'm just offering you this. Okay, so instead might be waiting. We could just try to see if you go into labor in the next couple days. You can try doing this or this. And then the N is, what if I did nothing? And that's kind of another way to ask what risks are. Like, okay, what if I just waited a while? And this is where they might be like, well, I'm willing to let you wait till you're 41 weeks, but then I'm really uncomfortable with waiting. Then you get even more information. Going through the scenario again, say you start with the B, well, what are the benefits? You're just telling me I'm 39 weeks. That sounds like there's not a whole lot of concern, except that's just kind of how we do things, right? And what you're comfortable with. Say the provider comes in and says, hey, your baby's actually, doing some things that I'm worried about, and sometimes the risks of waiting it out might outweigh the risks of inducing, because I'm concerned that the heart rate's not quite where we want it to be, or your baby hasn't been growing the last few weeks, and that's very concerning to me. Oh, okay, now we have actual information to tell us that this just isn't something like I'm telling you what to do and there's no reason behind it. So then we use that information to make our decision. Another question I like to add to brain is, can I have some time to think about it? So a really good example is just actually happened yesterday. So my daughter went to the dentist and she was going to get a tiny little chip in her tooth fixed. And I could tell she was kind of going back and forth, because I think she's had come to the decision like the chip didn't really bother her, no one really noticed. She didn't really know what that entailed, because when she was at the dentist last time, they just told her like, hey, you want that chip fixed? We can do that. And she was like, okay, I guess. Well, then she was thinking about it and like, well, I don't know, like what are they gonna do? Are they gonna have to drill my tooth? How is it hurt? Like how will I be able to tell it's been fixed? Those kinds of things. But my daughter's very quiet and doesn't know how to advocate for herself yet, and she's 14. And we ended up, I'm like, well, it's up to you, you can think about it, and we get up to the day of the dentist, and she hasn't really, like, I guess she was kind of like, I guess I'll do it, because I think she felt like, well, they want me to. And so she gets in the chair, and I just helped her advocate for herself. And I said, are there some questions you want to ask? And she finally said, yeah, like, what does this actually look like? And the dentist actually came in, and it was perfect, because she said, here's your 3 choices. We do nothing. Which, if it doesn't bother you, we can smooth it out, but it might look even more crooked, or we can fill it. But honestly, and we can certainly do that for you, because if that's what you want, we're gonna do that. But honestly, some people end up regretting doing it, because that chip, that filling is a lot more fragile from then on, and they have to be very careful with what they eat, and at some point they will typically break it off. And so many people kind of like, oh, if I had known that ahead of time, I probably would have just lived with a chipped tooth. So this was the perfect example of informed decision making. And then what happened, which I see so many times, and like we're all guilty of this, is my daughter's like, I'm already here. I've basically committed to being here. I can't back out now, it's too late. And I just told her it's never too late. They haven't started. And the dentist was perfectly great about it too. And she said, no, honey, this is your call. I am not going to be hurt if you decide not to do it. And she finally said, nope, I don't want to do it. And that was a huge thing, because the pressure of the expectations that we feel like providers put on us, like, well, you're wasting my time, or if you show up. And so this can be, whether you at the last minute decide not to have a C-section, or go get induced because you've gotten a bunch of information and it just isn't sitting right with you, or you need more time. But kind of going back to the whole time thing, like I need some time to think about it. And depending on the situation, asking for certain time limits. Like, so say, going back to the example of being induced, like, can I have some time to think about it? Like, how about next week when I come in for my appointment, I'll let you know. Or can we talk more about it then? Or can we wait till in 2 days from now? If you're concerned, can we, like, what are some ways we can make sure the baby's still doing great, and talk more about this? In labor, it might be like, can we have an hour? Or, you know, if it's a medical condition, like, I might come back later. Like, I don't know. Another thing you might want to add is, can I have some time alone to think about it? Because again, going back to the white coat syndrome, is it's very hard to make a decision, especially if it's against that person's advice, making that in front of them. So asking someone to step out of the room is totally within your rights to do. You can talk about it with family members, your support person, and then you're able to kind of be more free to be like, you know, now that I'm talking with you, that didn't make any sense. And so you can also invite them back to ask more questions, because once you've kind of absorbed the information, you might think, I still don't have enough. Or you can ask providers, well, if you were me, what might you do? And they might tell you. There's so many reasons behind medical advice, and it's not always like, okay, I'm very concerned. It might be, this is how we do things, or I just assumed you wanted that. Like the dentist, like, I assumed you wanted to fix your chipped tooth, and now that I'm hearing you, I can tell you, like, yeah, it's not always great. Or, you know, most women in my practice really just want to be done being pregnant, and I wanted to offer that to you, but the baby looks great, so there's really no concern here, and I'm happy to wait if you are. Or if you want to continue laboring, like, looks like you're getting tired, that's the only reason I mentioned it. So we always want to ask questions. And then the final piece to all this is knowing the right resources to get legit information. And I'm a big advocate of evidence-based practicing. So even if you have a practice where this is just how our policy is, like a lot of hospitals have policy. Well, policies aren't laws. We don't always have to follow that. We can ask the reasons behind them so that we can make that informed decision for us. We always have the choice to leave. Even in labor, you have a choice to ask for a different nurse if you're struggling with somebody, and that's also within your rights. You know, the internet's full of information. Even talking to me, like, you have to decide if I'm trustworthy, and if somebody they're open to questions, which I am, and where I'm getting my information, that should be always transparent. There's lots of great websites, and you just have to be aware of how to find information that has evidence-based practice behind it. Like, okay, this is kind of how they've always done it, but here's evidence to suggest, you know, there's more things to say. So anyway, all that to say is asking questions and having a truly informed decision is key to advocating for your own health. And my belief is that we all have the responsibility to advocate for our own health. Life isn't, these things don't just happen to us and we're just like, well, it just happened and I didn't have any choice in the matter. Like, this is our bodies, our choices. But one of the biggest keys is that, like, we do have the responsibility to get that information, to get the best care for ourselves, because it's on us and we have to own our health in that way. And one of the ways is to ask questions. You can find me on www.sarahannette.com, SarahAnnette. I'm a nutritionist, a Reiki healer, certified breastfeeding counselor, and childbirth educator and doula. So I've been doing this kind of work for over 10 years, and I just really love helping people learn and educate, because you can never learn too much, and the more you know, the more power you have. Thanks for listening.